I think with respect to suicide, we certainly have evidence now that the rates of suicidality and suicide completion in teens and kids is going up. One of the things I would say is we want to make sure that with kids who are actively suicidal, that they've been carefully evaluated, they have a safety plan in place. For kids who have passive suicidal ideation, like I might be better off dead than taking this test. Like we want to teach them kind of the difference between a suicidal crisis versus a fleeting thought. But I think that we are in a position as a society where we recognize that a child's mental health is more important than their portfolio. And I would like to see us get to the point where we can just basically say, it's okay. A really interesting thing happened on the college campus. The MIT had a couple of suicides, and MIT is a very pressured environment. It's one of the best academic institutions in the world. And they had a series of suicides, and kids just feeling like they can't compete, they can't keep up. And they basically, the faculty wound up taking kids to the museum instead of holding their classes and doing different things to basically show you that a well-rounded life in which you're not 100% focused on academics at all time is a better outcome. And many of the professors, I think, really stepped into that breach and tried to let the people know that, if you're not the top-ranked person in the student in this entire class, so what? And so I think that the long and the short of it is we do have a crisis in this country. There's an old misnomer, which is the people who are talking about it are not the ones who are going to do it. That's just not true. If I hear somebody talking about suicide and they weren't just making some kind of dark joke, you have my full attention right now, and I'll bring it up right in the minute. I noticed you just said this. Can you talk to me about how you're feeling? It's as opposed to they're all stressed. They're all stressed. Like no, not all of them are. And we got to pay a lot of attention to that both in our clinical work and also in our own families and our schools, all the places we find ourselves, coaching, you name it. If you have contact with kids, you should be mindful of that, aware of that, and not laboring under the myth that kids who talk about it don't do it. They do.